there's lots new in constipation. It's not just diet and fluids. The cases which are refractory in constipation, that is a constipation which has been adequately treated by laxatives, and yet the child is persisting with constipation beyond 3 months, we label the child as refractory constipation, and this child requires further workup. The anorectal manometry is one technique which is now being done in major hospitals, and it requires an expert pediatric gastroenterologist who does anorectal manometry. It's a very simple OPD based procedure. The child just needs to pass stool in the morning and come to us. No fasting is required. It just takes 5 to 10 minutes. Basically, we insert a small balloon like catheter in the anorectal area of the child, and we see on the screen the various pressures that the child goes through. So we ask the child to push, we ask the child to squeeze, we see the resting pressure, we see when we inflate the balloon whether his anal sphincter relaxes. We also see the coordination of push and relaxation in the child, and we also see how much can the child hold the stool. So all these pressure studies are basically done in a very playful method with the child looking at the screen and the camera and understanding. And in many cases, we find dyssynergia. The child is not able to expel that balloon when we tell him to push. And that is the time when the role of biofeedback therapy comes. Biofeedback therapy is basically explaining the child the right way to sit on the toilet and pass the stool. So many children, out of fear of constipation, prolonged constipation, painful constipation, get a fear. So instead of pushing from the abdomen and relaxing from below, they push from the abdomen, but they also squeeze from below. And in that case, the stool doesn't come out, and it leads to further pain and further constipation. So in these children, we do a biofeedback therapy sessions. We usually require 3 to 4 sessions. The first session, we teach the child how to sit on the toilet, the physiology of defecation, how to get rid of pain during defecation, and also some exercises of push and pelvic floor relaxation. In the second session, on the machine, in a play game method with the help of a software, we teach the child to push and relax and coordinate. So normally intelligent children above 5 years of age really enjoy this method and learn the right way, and they can go off the laxatives and just do proper defecation coordination on the toilet and be free of constipation. Constipation, if it's for a short duration like 1 week or 2 weeks, it can be easily managed by a pediatrician, where the pediatrician makes sure that they counsel you about the fluid intake of the child. So if your child is 10 kgs, that the child's fluid requirement in a day is 1 liter. So we make sure that the child is drinking adequate amount of fluids. Then similarly goes for fiber intake. If your child is 3 years of age, the fiber requirement of your child is age plus 3. So that means the child requires around 8 grams of fiber a day. So we make sure that we are decreasing the milk intake in the diet. We are increasing the fruits and the vegetables and the nuts in the diet so that the fiber content of your child is improving. Then we also make sure that the toilet position of the child is right. The child is sitting on the toilet in the proper position, not straining too much, pushing it properly. So all these small measures can help cure the constipation early. However, if the constipation goes beyond 3 months, then we label it as a refractory or incompletely treated constipation, and then we of course need to investigate the child further with the various different tests, and the child needs to see a pediatric gastroenterologist. We need to rule out dyssynergia and slow transit constipation or some anatomical problem in the child. We also need to see that the laxatives are being given at the right dose. If the child is impacted with stools and the constipation is so bad, it will never get better unless and until we disimpact the child. So we need to completely treat him with laxatives, empty his abdomen, and make sure that the constipation is not coming back again by giving some maintenance laxatives. The most common laxatives that they use in children are polyethylene glycol, which is very safe and can be used for long duration.
Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.